Colorectal Cancer Awareness Month, and our sponsors at UBMD Primary Care want you to know about all of the treatment and screening resources available to you. Welcome, doctors Kevin Hughes and Bethany Harvey. Thanks so much for coming in, doctors.
Thanks for having us.
Thank you so much.
Of course. Let's start off by talking about both of your roles with UBMD Primary Care and how you help your patients navigate their colon health.
Yeah, so my name is Dr. Kevin Hughes. I'm an attending physician medical director at UBMD Primary Care of Amherst. And really, we partner closely with our UBMD affiliates, including the colorectal cancer team, which Dr. Harvey is a part of. We really focus on collaborating to emphasize the importance of colorectal cancer screening, especially during Colorectal Cancer Awareness Month, because unfortunately it's becoming more and more of a major issue in even our younger population. So those patients that may say, oh, I don't have any symptoms, doc, I'm doing okay. Regardless, we want to catch these major issues before it becomes a major problem symptomatically. So really having these conversations on an annual basis with your primary care provider, discussing colorectal cancer risk, if you have a family history, or other major concerns. And then again, for those that are at average risk, starting colorectal cancer screening at age 45. And we send a lot of our patients over to UBMD colorectal surgery with Dr. Harvey, who can tell you a little bit more about her services and how she helps us with this mission.
Yes, please do.
Yeah, so I'm Dr. Beth Harvey. I work with UBMD colorectal surgery. I'm one of the colorectal surgeons, and we do colonoscopies for both screening and diagnostic colonoscopies. So if you're coming in at age 45 for your first screening colonoscopy, you can see me. If you noticed something's not right at home, you're feeling a little more constipated, having some bleeding that you're not really sure what that's from, we'll get you in as quick as we can and get you checked out to see if there's something else that needs to be done, or if there's just polyps that may be there that we can get and take out of your body before they become cancer.
Mm-hmm. Let's talk about why it's so important to raise awareness about this kind of cancer.
Yeah, so like we had discussed, we're seeing more and more of a prevalence in our younger patient population. I believe Dr. Harvey had noted that, by 2030, this is going to be a major cancer that is affecting a majority of, our brothers and sisters and family. So, we often kind of think about, oh, this is just something that we keep within the primary care office. You have some discussion with your provider or your physician, but it goes beyond that. Really, it's a public health awareness. It's conversations that you have with your brothers, your sisters, your mother, and your father, and your family to really raise awareness and the importance so that the screening modalities are being discussed and possibly taken care of in advance.
Let's talk about what those screenings look like.
Yeah, so there are a variety of different screening tools, but the gold standard of colorectal cancer screening is a colonoscopy. And I know that many people say, oh, I've heard you have to drink this big jug of salty water and it's this horrible experience. Well, thankfully, we now have lots of different prep solutions. Some are pills, some are smaller volumes of liquid, that we can really find one that works best for you so that we can help you get a colonoscopy, which is the gold screening. Gold standard. The reason we say that is because colonoscopy is what we call both diagnostic and therapeutic, which means we can see what the cause of your bleeding, constipation, diarrhea, we can find that cause and start treating it at the same time.
Okay.
So if you do have a polyp that looks like it's precancerous, we can take that out, and that eliminates the risk of that turning into a cancer for you.
Are there any, you mentioned some of the signs to look out for, but unfortunately, I've been noticing personally on social media, a lot of people, especially young people, are joking about how little they don't go to how much they don't go to the bathroom. And that could be a really big sign, right? An indicator.
Yeah, unfortunately, in patients under the age of 55, 1 in 5 patients under the age of 55 are being diagnosed with colon cancer. And so these patients sometimes don't have the classic symptoms of having bleeding. Sometimes people just notice they're a little bit more constipated than normal, or they say, oh, my hemorrhoids are acting up. Some patients don't have any symptoms at all and only come in once their cancer is progressed to a more significant stage. And so we always want patients to come in if they're having questions, talk to their primary care provider first, and they can try a couple of different tricks and solutions to help with their constipation, but if it's not changing, they'll send them over to us to get a colonoscopy and take a look at what's going on inside.
Well, how can our viewers reach out if they would like to get themselves a screening?
Absolutely. So we are always accepting patients at UBMD Primary Care. We have a multitude of locations. Again, I'm at the Amherst location on the corner of Hopkins and West Klein. We have a Tonawanda office on Sheridan Drive, and then we also have our Conventus practice in downtown Buffalo, right next to Buffalo General. We have information that we can distribute regarding reaching out to us, getting established, and then also setting up these consultations and discussions regarding preventative health, including colorectal cancer awareness, and getting you over to Dr. Harvey and their team to discuss this further as far as colonoscopy.
Alrighty, Dr. Hughes and Dr. Harvey, thank you so much for coming in and bringing
Thank you.
awareness to this important topic. Viewers,
you.
to learn more about our sponsors at UBMD Primary Care and the cancer screenings and treatment they provide, you can visit the links right there on your screen at ubmdprimarycare.com or ubmdsurgery.com. Thanks again for coming in, doctors.
Thank you
Thank
so
you so
much.
much.
Coming up